I'm Dr. Sally Ure. I work in Whanganui-a-Tara, Wellington in Aotearoa. I'm an obstetric anaesthetist and I hold some leadership roles as well. And I've been a FANZCA since 2007. I kind of say it's like a state of suspended animation almost, that you are deeply unconscious and unaware of your surroundings. And then I say, and your anaesthetist is there to keep you safe the entire time. We listen to every heartbeat and every breath you take, you know, like that song from The Police. So I really do emphasise how safe it is. So it starts from the very first moment that I meet them. I ensure that I greet them, I use my first name, I pronounce their name correctly. I try and greet them in their own language if it's possible. It's very easy to use Google Translate and make sure you get it right. And I explain my role as an anaesthetist. I do tell them actually that I'm a doctor, that our training is very comprehensive and that you have to do medicine for 6 years and work for another couple of years as a doctor and then train in anaesthesia for at least 5 years before you can become a specialist. How do I convince them that they're safe? I think that's one of the joys of anaesthesia for me actually, because you've got a very short period of time to convince someone that you are trustworthy and that you have the skills to keep them safe through the entire operation. So I usually say my patter about, I'm going to listen to every heartbeat, I'm going to listen to every breath you take, I'm never going to leave your side, and give them the confidence that I have the skills to ensure that they wake up safely. I think somebody who is empathetic, somebody who has fantastic communication skills and can communicate with the patient and with their whānau in a way that's really meaningful for them and what's important to them, the risks and benefits, and just narrate what's actually happening in the operating theatre. I think that when you look at the bell curve of risk aversion and risk appetite, that we probably lend more to risk aversion. But at the same time, you need to have the confidence and the ability to make decisions and act when you haven't got all of the information, for example. So you do need to be able to work with uncertainty. And you have to be very detail focused. At the same time, you have to have the ability to really zoom out and look at the big picture, whether it's the big picture for the patient or whether it's the big picture for the operating suite or even whether it's the big picture for the hospital, and work out what the best thing is to do. I love the variety of the job. I love being in operating theatre and being part of a team. I love the fact that we work outside of the operating theatre as well, and have roles in leadership. Anaesthesia touches every part of the hospital, and so we're very good at organisational leadership positions, and we're just not in the operating theatre. We might be in a remote site helping somebody have an x-ray, and my particular subspecialty is obstetric anaesthesia, and I love being on birthing suite. So I love the challenge of obstetric anaesthesia. It's a time of a whānau's life where they're very vulnerable, and I find it really joyful to empower them to make their own decisions in their birthing journey. Our role in the delivery unit involves pain relief, so putting in epidurals or providing other sorts of analgesia after talking to the patient about what they want. And of course we're there for caesarean sections as well, and it's an absolute joy for me to meet a woman who's about to have her baby, who's feeling very anxious because she's maybe never been in an operating theatre before, to put her mind at ease, to have her and her partner laughing before we even go into the operating theatre. That's when I know I've nailed it. So we know that patients do best when their care is provided by somebody who looks like them. And for that reason, it's just so important that we have more Māori, Pasifika, Aboriginal and Torres Strait Islander trainees coming through our training program to really support those populations that are socially deprived. We know that Aboriginal, Torres Strait Islanders and Māori, and to extent Pasifika, even in Australia and New Zealand, have worse health outcomes, and that is not right. And we as a college are doing everything that we can to address that.